KNBC4 News at 5 starts now.
It can be a confusing topic for women, and now some new guidelines straight from the American Cancer Society about when to get a mammogram.
Major shift in the battle against breast cancer. The American Cancer Society is changing the guidelines on mammograms. So when should women get them, and what's behind this change? Carolyn Johnson has details on what you need to know about this. Carolyn?
Well, Colleen, the American Cancer Society relied in part on new research out of UC Davis that finds the risk of aggressive breast cancer is much greater for premenopausal women. And these new guidelines reflect that, moving the recommended age of a first mammogram from 40 to 45.
You can hang on over here.
When a government panel changed the recommended age for mammography from 40 to 50 6 years ago, not everyone agreed, including the American Cancer Society. But after extensive research, it's now changing its recommendations.
By age 45, all women should start regular screening every year.
The reasoning is women in their early 40s are at lower risk for the disease, but at higher risk for false positives and unnecessary invasive tests. Since premenopausal women are at greatest risk, the Cancer Society now recommends yearly screenings at 45, but says patients should have the option to start at age 40. At age 55, the recommendation is to get them every other year.
Okay, just relax.
Some breast oncologists say these latest guidelines are still confusing.
There are some caveats and qualifications, and I think that starts to make it a little more complicated. It's not that simple one-sentence recommendation that we had in the past.
Dr. James Maxwell is medical director of breast imaging for RadNet in Encino. He's concerned about postponing initial screenings to 45 and going to biannual exams after age 55.
If you do less screening in that age group, you're still likely to find cancers at a later stage, and that may affect the patient's outcome and treatment options.
Clinical breast exams are no longer recommended either.
The life-saving potential of early detection really is found in regular mammography. That's the test that can find a cancer before anybody can feel it, before the clinician can feel it, or before the patient can feel it.
Keep in mind, these guidelines are only for women with an average risk of developing breast cancer, those without a family history of it. Now, it's important to note the majority of women with breast cancer have no known family history of the disease. These new guidelines do leave room for women and their doctors to make individual decisions about screening, and the recommendations should not impact health insurance plans, most of which are mandated by federal law to pay for mammograms. Chuck.